Is it possible to reduce cholesterol naturally? I'm Dr. Rawat, an Indian origin, England-trained, Canada-based family physician who additionally studied nutrition at Harvard and founded healthgroupcoaching.com, where I run a 4-week virtual chronic disease reversal program. But first, why is it important to reduce cholesterol? Cholesterol is a risk factor. It increases risk of what we describe as cardiovascular disease, heart disease, strokes, dementia, kidney dysfunction, etc. It is one of many risk factors. And it's important to understand that risk factors will layer over each other and increase risk. But having high bad cholesterol or LDL cholesterol, more specifically ApoB, plus minus the familial genetic lipoprotein a, are one of the most dangerous risk factors for heart disease. It's important to appreciate that while LDL can be reduced by lifestyle and dietary measures, in some cases such as familial hyperlipidemia, that might not be possible. So it is very important to measure your levels regularly and seek advice from your physician as to whether and when medication might be required. Now, for those people who wish to reduce their serum bad cholesterol or LDL levels while consuming less saturated fat is important. It's important to understand that dietary cholesterol is a relatively small part of the amount of cholesterol which turns up in your bloodstream. There are many factors. Remember that cholesterol can be synthesized by every single cell in your body. Factors within your liver decide on the amount of cholesterol receptors there are on the surface, which then suck in cholesterol from the bloodstream. And factors within your gut, your Niemann-Pick receptors, your gut microbiome can modulate that. Also decide how much of the cholesterol in your gut, whether this is dietary cholesterol or recycled cholesterol, which is being pulled away from the bloodstream into the liver, into the bile, and back into the gut, gets reabsorbed. So you could say that cholesterol is mediated at 4 main levels. One is familial, genetic, which you can't really have much control over, but others being your diet, your liver health, and your gut health, particularly gut microbiome health. So I describe 5 main areas you need to work on to reduce cholesterol. And remember, this will take time. It won't happen overnight. Number 1, reduce your intake of saturated fats. These include red meats, ultra-processed foods, deep-fried foods, and solid dairy such as butter, ghee, lard, etc. Second would be to increase your intake of unsaturated fats or healthy fats. These include fish, avocados, olives, nuts and seeds. And one advice I often give to my clients is if you need a snack, instead of having croissants and cookies, instead have nuts and seeds. The third dietary action to take is increase intake of fiber. This has multiple benefits. Fiber intake is also correlated with reduction in risk of bowel cancer, diverticulosis. You should be aiming for anywhere from 25 to 40 grams per day of fiber. And you can get this through green leafy vegetables, whole intact grains, oats, lentils, legumes, nuts and seeds. The fourth thing to do is to improve your liver health, because it's your liver's job to vacuum or suck out cholesterol from your bloodstream to then shuttle it back into the gut for excretion. And if you have fatty liver, if the liver is already clogged up with cholesterol, then it's like the carburetor in your car or your air filter being full of soot and needing a clean out. So anything you do to reverse fatty liver will eventually reduce your triglycerides and reduce your total cholesterol as well. And I'll have a whole separate video on that topic. Along with dietary changes, simply reducing belly fat and being in a calorific deficit will improve that situation. But of course, that's something which will happen over weeks and months. And finally, if you have a dysbiotic gut microbiome, then improving that can also reduce the excessive reabsorption of cholesterol happening at the gut level. And there are certain probiotics which have been shown to reduce cholesterol. If you head to my website, healthgroupcoaching.com, click on supplements and blogs, you'll find a blog that I've written on how to reduce LDL cholesterol. You'll find a more detailed video, as well as some Amazon links to supplements which you could consider in order to reduce the cholesterol, such as omega-3, fiber, and certain probiotics which have evidence to show reduction of cholesterol. If we go through some of these studies, this is a study which showed how omega-3 supplementation can reduce liver fat. And as we discussed, if the amount of liver fat is reduced, then the clearance of cholesterol will be improved. This is a study which showed that in type 2 diabetics, addition of fiber improved constipation, reduced weight, reduced sugar, and also improved cholesterol. This is an animal study in which they demonstrated that use of resistant starch, which is a form of insoluble fiber, improved fatty liver in mice. And this is a study published in Cambridge University Press, which demonstrated the efficacy of this particular probiotic in reducing cholesterol. Finally, it's really important that whatever you do for your cholesterol is done in conjunction with your primary care physician. This is because treatment of cholesterol will be different in a 30-year-old versus a 60-year-old. We have to look at other parameters to calculate risk, including your blood pressure, sugar, inflammation, lipoprotein little a levels, etc. And so the decision really needs to be made between you and your physician. So don't try to go do this on your own. Also, if you feel you've made positive changes to your lifestyle, then make sure after around 3 months or so, get the levels repeated. Don't just presume that your cholesterol will improve. Measure it and check it. If you'd like to receive coaching from me on a 4-week virtual program designed to reverse chronic metabolic disease, then visit healthgroupcoaching.com and sign up, or just send me an email through the website. This is a 4-week virtual program for reversal of metabolic diseases such as fatty liver, prediabetes, polycystic ovaries, metabolic syndrome, which is increased triglycerides, low HDL, increased waist circumference, sleep apnea, prehypertension, and chronic systemic inflammation. Hundreds of patients have gone through the program. You can read the testimonials. You can see this lady was with me in 2023. It comprises of 2 main aspects. One is group Zoom coaching classes, which are for 1 hour each, which take place typically on a Tuesday and Thursday evening, Eastern Time. Even if the time of the class does not match your schedule, you do get a recording of the session and a PDF of all the presentations emailed to you straight after the class. The second part of the program is tracking, where you're asked to download a free app called Chronometer, and certain items from Amazon like a body fat percentage scale, food weighing scale. Make sure you have a smartwatch which measures your steps and your sleep. And once I start tracking you on Chronometer, I can see your data in real time. There is direct messaging within the app, and I can adjust your calories, macros, supplements, etc. through direct messaging on the app. To sign up, just click subscribe on the program, and most people will be starting with this package here at the top. I hope you found the video useful. Do remember to like and share it if you did. Take care, and I'll see you at the next video.